according to Baltimore City Councilman Yitzy Schleifer.
I think it's a matter of life and death.
Baltimore City's EMS system is experiencing an emergency of its own.
Across the board, we have a high call volume, and we're short-staffed, and so when our EMS personnel are standing in the hallways of ambulance bays at hospitals for extended period of time, that's keeping them from saving lives of patients out on the street.
At a recent hearing with Baltimore City's fire department, frustrations raised over the amount of time ambulances are spending held up at area hospitals. Between the time an ambulance arrives and leaves a hospital, the department says 30 minutes is the national standard. But in Baltimore City,
it really runs about 50 minutes to an hour.
Earlier this month, fire officials saying Sinai Hospital held them the longest, averaging 70-minute drop-off times.
And so that's more than double what would be average, and that's quite concerning.
In response, Sinai Hospital claiming wait times are influenced by a number of factors, including high inpatient volumes brought on during cold and flu season. But they're far from alone.
Maryland ranks dead last in hospital offload around the country. It's Maryland is dead last. We're 50th in offload.
And if ambulances are waiting, patients are too. According to the Centers for Medicare and Medicaid Services, for the past 8 years, Maryland has had the worst ER wait times in the nation, with patients waiting an average of 4 hours to be seen.
So I'm like, okay, he got there in the ambulance. Why is he not in a bed?
Overnight at Johns Hopkins Howard County Medical Center,
I'm going to get someone. I'm sorry we're full. I'm sorry there's no beds. Just the same stories, but no urgency, no real care, no real compassion.
Shameen Coleman says her daughter's boyfriend waited nearly 7 hours to be seen for complications related to a gunshot wound he sustained last December.
In pain, constipation, vomiting, throwing up. His wounds were oozing, fluids.
And once he did see a doctor,
they said he needed to be admitted, but there's still no beds.
Coleman says they're now making the trip to George Washington University Hospital in D.C., hoping to receive more timely care.
Because the wound is in his stomach and it's affecting his kidneys and intestines, he needs to lay back. He's been sitting in a wheelchair this whole entire time.
The hospital says due to privacy laws, they can't comment on a specific case, but did say addressing this issue is a top priority for JHM, leaving people like Coleman asking, how long will they have to wait to see shorter wait times?
There's no care, there's no love, there's no real support, and no one listens.
Sinai Hospital also says that its ER is under major renovations and seeing an expansion that will hopefully help reduce ER wait times. Reporting live in Baltimore City, Rebecca Pryor, Fox 45 News.
I'm Mary Bubala. Thank you for watching. Here's another video for you to watch. Also take some time to subscribe to our YouTube channel.